Is bariatric surgery safe? Bariatric surgery or surgery done for obesity is generally considered a very, very safe surgery. The incidence of direct surgery related complications such as anastomotic leaks. Anastomotic leak meaning where we cut the stomach or join the stomach to the intestine, the suture line leaks and then you have infection in the abdomen leading to problems. So these kind of complications are less than 1 in 200. With the advanced technology we have like stapling devices and reinforcing devices, the leaks are very low. Other complications such as cardiac complications, respiratory complications, DVT. These are the three most common problems the patients can encounter after any major surgery, especially the obese patients. Cardiac, then respiratory, and DVT, that is blood clots forming in the lungs and going to the lung. Blood clots forming in the legs and going into the lungs. So these kind of problems can occur post-surgery. Obviously, patients who are obese are at a slightly higher risk for these complications compared to a person with a normal weight. But these kind of complications can be avoided by doing a thorough preoperative evaluation by a cardiologist, pulmonologist, assessing the DVT risk score and giving them better perioperative care like giving them anticoagulation, giving them DVT stockings which actually compress the lower limbs and prevent the blood clots from forming. Very well coordinated surgical team which can finish the procedure effectively, and a good post-operative care by mobilizing the patient quickly and actively. So with all this, despite these patients, the obese patients being at a higher risk of complications compared to the general population, the incidence of these cardiac, respiratory and DVT complications is still very, very low. Essentially, it boils down to any procedure. There's no such procedure with zero risk, but when you look at a surgery like bariatric surgery, you have to weigh the risks and the benefits. The risks obviously are because the obese patient, diabetes, there's a risk of cardiac, respiratory and DVT kind of problems. While the benefits are of obviously the long-term cure of diabetes, hypertension, weight loss, reduction in risk of heart attack, stroke, reduction in risk of cancer. So we in any medical decision, we need to actually balance the risk, and most of the time in these patients, the benefits far outweigh the risks. There's another confusion among a lot of general public about some Bollywood actresses who succumb to sort of bariatric surgery. That is not true. A couple of famous actresses, I would not take the names, but who actually died secondary to a procedure called liposuction. I mean, liposuction again is a fairly safe procedure done by plastic surgeons. It is basically doesn't alter your metabolic in any way, doesn't alter your glycemic sugar control, doesn't alter your cardiac risk or anything in any way. It is just in one particular part of the body, like your abdomen or in your buttocks. If you have excess fat, it is sucked out through needles. So when they do it on the abdominal, when abdominal liposuction, repeated surgeries are done, the abdomen becomes scarred and the bowel gets stuck to the abdomen. And when they're doing this liposuction, the bowel can get injured. So the couple of famous cases are actually secondary to abdominal wall injury and bowel injury sustained due to repeated liposuction. So to summarize, bariatric surgery is a very safe surgery done in experts' hands with a good perioperative team, the anesthesia, the post-operative respiratory care team, if they're very good, with a good surgeon. It's a very safe surgery. We have to take the necessary precautions, necessary preoperative evaluation. But essentially, these patients are slightly higher risk compared to general population. But most of the time, the benefits of surgery outweigh the risks.